Hey guys, so I recently had somebody ask me this question in my personal life, and I thought that I would also share it here because I feel like people might have this question more than I realized people would. But firstly, let me apologize for the lighting in this video. This is like the best place that I can put my camera to talk to you guys while I'm at my godmother's sister's house. So, anyways, back to the video. I was asked why they made me stop taking metformin and Ozempic and all of those things before having my gastric sleeve surgery. So I'm just going to give you guys a quick little rundown. Prior to surgery, they had me stop taking basically all of my medications except for my seizure medication. So they wanted me to stop taking the metformin because they were concerned. I mean, I had already stopped it because, as you guys know, I have a Dexcom because I have blood sugar issues. I have had issues with hypoglycemia and my blood sugar going high randomly. And so there's a lot that goes into that whole story. I have multiple videos about it. However, yeah. So I had already stopped the metformin because my primary care doctor basically wanted me to stop taking anything that could potentially lower my blood sugar. And because it was going so low at night that it was like in the 30s multiple times overnight. And so we were a little bit concerned about that, obviously. But they made me stop the Ozempic for a different reason. And I actually got one last dose of the Ozempic prior to me having my surgery, or my consultation, my last appointment before surgery with one of the PAs from my surgeon's office, when he was like, well, you snuck that last one in there. Don't do it again. I didn't know because these were appointments that were scheduled at the last minute prior to me having surgery. So I had been taking my Ozempic shot on Saturdays or Sundays, depending on the week. And it just so happened that I think it was like Monday or Tuesday, I had an appointment with him to go over my medications and for him to tell me which ones they needed me to stop taking. I'm not sure the exact reasons for stopping all of my medications, but specifically the Ozempic as well as the metformin, they don't want you taking those because it can affect your blood sugar. And when you're recovering from surgery, apparently it's really common for bariatric patients to have struggles with their blood sugar. I mean, you're not really consuming carbs, especially right away. You're on a liquid diet, at least most people are after surgery. And so that's something that you have to take into consideration. There's a reason why they're telling you to stop certain medications. I don't know the reasons behind all of them. There are other medications that I was taking. I was taking a stimulant to keep me awake, modafinil. I've talked about that. That was when I was working in the sleep center and couldn't really adjust to be able to fall asleep with a normal schedule. I couldn't adjust to day shift or night shift because they had me working both shifts multiple times in a week. So I would have 2 days of day shift, 2 days of night shift, or 3 days of night shift and 1 day shift, and it would throw my whole body out of whack. So the Ozempic specifically, they had said they wanted me to stop taking because Ozempic can actually make things digest or move through your digestive system slower than normal. And that is part of the reason why Ozempic helps with weight loss. Ozempic is not really a weight loss medication, but they say that weight loss is like a side effect of this medication. It is actually intended for people who are pre-diabetic or diabetic because it does help to better control your A1C and things like that. So I was using it kind of for both reasons because initially we thought I was type 2 diabetic. I now know that that's not the truth. That's not the case. So I have multiple medical conditions that I just haven't had the time or energy to make a video talking to you guys and explaining everything. But they wanted me to stop taking the Ozempic because they didn't want anything to slow down my digestive system when I wasn't really eating much to begin with. So when you're on that liquid diet, you're really not consuming very many calories, and the food that you're eating, you don't want to be constipated. And I struggled with constipation prior to surgery, and I've still struggled with constipation throughout. A few days ago, I reached my 10-week post-op point, and so I am currently 10 weeks post-op, and I still struggle with constipation. I do take Miralax on a regular basis, which my GI specialist said was okay to do, because it's not a specific type of laxative where your body could like become dependent on it. So she said I am allowed to use the Miralax on a daily basis if it's helping me have bowel movements regularly, which is something that you want. They also had me stop another medication that the GI specialist had actually prescribed to me because that medication can cause constipation. And again, we don't want these complications following surgery. When you're trying to recover, you're trying to adjust to a new diet, and like it's a lot. And to add constipation into the mix, which is something you don't want in the first place, regardless of whether you're recovering from surgery or not, just don't do it. So the Ozempic, like I said, slows down your digestive process, or the speed at which things move through your digestive system. So that was basically the main reason, not to mention that it can also lower blood sugar throughout a process. I'm not sure exactly like the, what word am I trying to think of? Like the mechanism of action. I'm not really sure what exactly it does to your body that causes those things, but those are the main reasons why they told me that I needed to stop taking Ozempic. Again, every surgeon's office may say something different regarding whether you're allowed to keep taking your medications or not. So if you are someone who is about to go through surgery or something like that, reach out to your surgeon's office and ask them. If you have any questions, the first person that I would ask is your surgeon or a PA or a nurse who works for your surgeon. Get some answers from your surgeon's office because they have the best recommendations based on your personal medical conditions. And, you know, those are the people that you need to be listening to. So anyways, hopefully that was helpful. If you guys have any questions regarding weight loss surgery, gastric sleeve, anything, let me know. I'd be glad to make a video about it for you. And with that being said, I will talk to you guys next time.